Hi, I'm Bons Magsambol and you're watching Rappler Talk. For today's episode, we'll be talking to former police chief and newly appointed Health Undersecretary Camilo Cascolan. What are his plans for the country's healthcare system that has been tested by the COVID-19 pandemic? Hello, Yusek Cascolan. Welcome to the program.
Good afternoon, and thank you very much for inviting me here.
First of all, congratulations, Yusek, for your new position.
Thank you.
Ayan, to start off our discussion, Yusek, can you walk us through about your appointment? Did you apply for it or was it offered for you by President Marcos?
Well, first of all, Bonds, I really this job is is very challenging because first of all, my preference was actually for national security positions, but I was talked to some of the my friends who are doctors actually, and asked me if I was willing to be assigned in departments where I could actually lead managerial and operational activities. And I said yes. And luckily enough, and fortunately enough, I was assigned here at the Department of Health.
Okay. So you mentioned that yung gusto nyo talaga is for the national defense, right? So bakit po DOH? Bakit DOH yung in-offer sa inyo ng president?
Well, I told them, I told my friend doctors that I'm willing to be assigned everywhere. You know what, Bonds? We are public servants, and public service is actually our forte. And we are a family of public servants. Actually, my mother, my father, my my brother, and four of my sisters are working with the government. And this is actually a service of which we have chosen.
Okay, right. So, bali yun nangyari dito regardless kung anong agency, right? Since
Yes,
yun namang
yes.
expertise nyo talaga is on managerial. So, you were criticized, of course, for accepting the appointment despite not being a medical doctor. Ito yung criticism na natatanggap nyo dito or wala daw kayong knowledge sa public health. How would you react to this and how would you convince the public that you were needed in the DOH? Siguro, let's take this opportunity rin, siguro to convince them that kailangan talaga kayo sa DOH.
I didn't say that one. I'm not really so knowledgeable when it comes to medical activities. The thing is that I think the populace has forgotten that the PNP were the first ones who responded to the COVID pandemic that was in 2020. And it was I actually who was then the deputy chief for administration that initiated the first meetings on COVID-19, on anti-COVID-19. And we had law enforcers with us. Of course, a lot of them were with us. Even NBI was there, Coast Guard was there, the AFP was there, the whole Philippine National Police family was also there, and even the Department of Health was also there. I remember once when the former Secretary Duque was also with us, and we were actually directed by by President Rodrigo Duterte then to come up with anti-COVID activities immediately, and the PNP were the first responders.
Okay, right. So the president, of course, President Marcos and health officer in charge, Maria Rosario Vergeire, have repeatedly said, actually, they were explaining to the public na you were hired, of course, you were appointed for your management expertise that will help the health sector. In what ways, Yusek Cascolan, kaya natin mai-apply itong management skills natin? And what are the problems in the agency that you think need fixing?
Well, I thank the Kwan. I thank the President Bongbong Marcos for supporting me and at the same time appointing me as Undersecretary of the Department of Health. So, of course, with OIC Yusek Rosario Vergere, Maria Rosario Vergere, for her for her trust in me too and confidence. And I think I would be a big help considering that I have managed PNP units, and of course, not only with regard to law enforcement, but also with regard to managerial and administrative functions in the Philippine National Police. I came, I rose from the ranks, and I became the chief PNP. And I believe that with this kind of experience for for at least 38 years, 7 months, and so many days in the service, I have done good. Um, there were a lot of crises that happened in the while I was there in the Philippine National Police, and I had with the knowledge that I had and the experience that I had too, I was able to, of course, come up with a lot of initiatives that had helped the Philippine National Police in its operational and managerial functions. And of course, with that experience, going to and fro and coordinating with local government units, coordinating with the private and the public sector is one of the things that is needed actually in coming up with the best initiatives, most especially for the community.
Okay, Yusek Cascolan, you mentioned na marami talagang kailangang ayusin dito. Actually, across agencies naman eh, right? And of course, we are in a pandemic. So, meron ba kayong concrete problems or nakikita na pwede nyo ma-share sa mga nanonood sa atin ngayon na sa tingin nyo kailangang ayusin ng ahensya and sa tingin nyo na matutulungan nyo with your expertise sa management?
Yes, yes, of course. All departments have their own problems when it comes to managerial and administrative functions. I'm not saying that there are problems here already at the DOH because I'm just new here. Of course, this will be discussed in our executive committee meeting together with the other USECs, with the OIC, with OIC Vergere and other assistant secretaries involved in the execom. I just wish that with whatever evaluation we would be able to undertake, we would be able to, undertake a lot of initiatives to improve services to the public, most especially in the Department of Health. Alam naman po natin, Bons, na andito pa rin ang COVID. And, well, it has been here with us ever since. It has been a pandemic, but this time around, the COVID-19 has been controlled. And with this, we are hoping that government services, most especially with regard to health, will be delivered much more better, of course, and at the same time come up with initiatives that would be much more help to the community and of course to the services of the people.
Okay. On Tuesday, November 15, Health Officer in Charge Maria Rosario Vergere said that you will be in charge in the operations in the Visayas. So why specifically Visayas? Was this position created specifically for you po?
Well, Bonds, I'm new in the Department of Health, and I still need to learn a lot of things, most especially when it comes to health, of course, health. No? And I'm just hoping that I would be able to learn fast. I'm hoping too that my initiatives or my managerial and administrative expertise would be of help. And I'm hoping that with this FICT, as they call it, the ano nga ba ito, FICT for Visayas, I would be starting it, of course, with a lot of operational supervision over hospitals, regional um, offices of DOH, and with other uh, wellness clinics in the area. Kumbaga,
Okay.
Bonds, kasi I need to learn. I still need to learn. And I know that by this FICT Visayas, the OIC Vergere has given me a chance to at least learn more, learn a lot of things in the field, and be able to implement operational, managerial, and administrative functions to the region.
Okay, right.
regions.
So open naman kayo no sa lahat. Pero like if you were given of course the option to choose which specific unit in the agency yung sana ma-assign sa inyo. Meron ba kayong inaay sana of course na sana dito na lang ako nalagay ng DOH if meron kayo of course option.
Actually, wala naman. I'm
Okay.
not eyeing any any position bonds. It's good that FICT is there because it's operational. It's purely operational in nature.
Okay. Since we're talking about the Visayas, of course, Negros Island lags behind the rest of the region in terms of the COVID-19 vaccination. Meron po ba kayong plans to increase at least yung vaccination uptake natin kasi sobrang baba nitong uptake ng vaccination natin sa Negros Island?
Well, you said that. Mababa yung rate ng vaccination sa mga islands na to. I hope to be able to implement 100% vaccinations in these areas so that at least safe na yung ating community.
Okay, meron po ba kayong specific plans or meron ba kayong strategy at least kahit na idea lang, bigyan nyo lang yung idea yung public on how would you encourage people, of course, to get vaccinated against COVID-19?
We'll see. I'm not yet. It's hard.
Okay.
Mahirap bonds magsalita muna ngayon, but I'm just hoping, with the, of course, with the support of the other officers and employees of the Department of Health, and of course, with the in coordination, cooperation with the local government units and the community, we hope that with activities and initiatives, we would be able to come up with 100% vaccination in all these areas.
Okay, sige. Moving on to another topic but still on vaccination. In August, it was bared that some 20.7 million worth of COVID-19 vaccines have been wasted. As someone, according to the DOH and the president, whose forte is logistics, how will the government ensure that this horrendous vaccine wastage during the past 2.5 years won't happen again?
Well, let's evaluate the management of supplies, which is actually we call the supply chain management. We hope that we would be able to keep at the same time evaluate warehouses wherein vaccinations are there, come up with scheduled dates of releases. Maybe that's one initiative that we could do. Secondly, is that of course be able to talk with the local government units and all those to be involved, and all those involved, so that we would be able to release on time. I would be able to suggest and recommend the release in time of these vaccinations to the community. Kailangan maibigay ang mga ito sa mga karapat-dapat na tao. And I believe that's one of the one also. I believe that's one of the programs also of DOH even before. Kailangan lang talaga yung maging masigasig, tapos maging coordinative and cooperative with the local government units and the barangays.
Okay, right. For my next question, this is about boosters. So ito, yung Cascolan, medyo nagkaka-problem din tayo in terms of boosters. Kasi 'di ba, ako meron na akong first booster. Pero yung ibang marami sa mga Pilipino na meron ng natakompleto yung first series ng primary series ng vaccination, natapos na nila. Pero yung booster, marami pa rin yung hindi kumukuha. Sinasabi ng iba na parang yung term daw ng booster, it connotes something na hindi naman yan kailangan i-boost lang yan. So, something extra. Di ba? Parang ganun yung nagiging connotation when it comes to boosters. Pero yun nga, it remains low in the Philippines and this is very crucial as we move on into our lives and live with the virus. So, may plans po ba kayo, of course, to at least increase the booster uptake in the Philippines, lalo na we're into the third year living with the pandemic?
Well, I'm here, Bonds, to support the program of the Department of Health, most especially under the leadership of the President Bongbong Marcos and OIC Rosario Vergere. First of all, of course, maybe one of the reasons of which I still have to evaluate is to educate our people on what boosters really are. I have 2 boosters already, and it has helped me a lot. Siguro, kulang lang naman siguro dito yung explanation at saka pag-educate sa ating mga kababayan bakit kailangan pa natin ng booster. Parang internet din yan, di ba? Kung mahina ang internet mo, you need to boost it, di ba? And kung ibo-booster mo siya, siguro sa internet, once lang naman ang booster eh. Pero syempre, pag vaccination ng tawag dyan, of course, sabi nga nila, vaccinations are supposed to be, kumbaga, kung minsan yung vaccinations, 1 year, 6 months, we just need to maybe educate our the people so that they would know much better what boosters really are.
Another serious problem in the health sector, so ito naging problem na 'to during the pandemic, actually even before the pandemic, nurses have been leaving the country in their quest for better working conditions. And up until now, malaking problema pa rin itong mga health workers natin na underpaid, overworked, and actually lagi silang mga nasa streets, protesting for their delayed and unclaimed benefits. What are your suggestions, of course, to solve the problem on delayed benefits and unreleased benefits allowances of our healthcare workers who are in the front line of our pandemic response?
Bonds, one of the things that I really intend to do is to boost the morale and welfare, most especially of our frontliners, especially those who are in the medical field. I have done that in the Philippine National Police, and I hope that I would be able to help the employees, most especially the nurses and the doctors who are, as you've said, have not yet received bonuses or etc. or whatever the government has given, has given and is still giving. I hope to discuss this with the Execom because it has also catched my attention, considering that there are people who are complaining about this. I still have to ask, of course, and at the same time, uh, through the executive committee meeting, we will be able to come up with solutions on how we would be able to help out in the, of course, in the boosting of morale of our people, most especially in the field.
Okay, right. It's interesting and actually it's really glad to know na parang ito talaga yung parang nakikita nyo din na problem na kailangan ding bigyang pansin ng Department of Health, which is the boosting ng morale nitong ating mga healthcare workers because after all, sila
Yeah.
kasi yung nasa frontline talaga ng pandemic
Totoo. Alam mo,
response.
Bonds, if I may add, alam mo, when the PNP went to the streets to at least prevent the spread of COVID through the conduct of checkpoints, choke points, and educational information to our kababayans. We in the headquarters were also busy coming up with medicines and vitamins for our people, and we distributed this to all the checkpoints, most especially here in southern Luzon and northern Luzon and NCR, of course. Wala lang masyado sa northern Luzon kasi ang ang focus natin nun was NCR and those areas going most especially to the south. Kasi nga, yan yung daanan yan ng ating mga kababayan papuntang south. So, this is what we work for. And we're hoping that while we are already being able to prevent the spread of COVID, we would be able to learn more how to come up with activities that will, of course, take care of the welfare of our people, most especially with regard to their morale.
Okay. Ngayon, optional na yung pagsusuot, of course, ng face mask indoors, outdoors. Yung mga bata, mga estudyante natin, balik na sila, of course, sa in-person classes. And yung mga nightlife natin and gatherings, 100% ina-allow na siya. Basically, wala, para medyo balik na tayo sa pre-pandemic na buhay natin. Tanong ko sa inyo, Yusek Cascolan, do you think we're nearing the end of the pandemic?
Well, the virus will always be there, as discussed to us by one of the doctors. All we really need to do is, let's say, number one is vaccination. Number two is, of course, evaluate ourselves always. Whenever we go to areas where a lot of people are in, we should be able to, if we think that we need to wear our mask, then let's just wear a mask. Um, the non-wearing of masks is actually a way of boosting tourism the Philippines, in our country. And it would be a great help if everybody, of course, got vaccinated and got boosted twice, or the others have been boosted for a lot of times already. Ang atin lang, pansinin nating mabuti sarili natin, ang katawan natin. Kung sa tingin natin, medyo meron tayong mga simptomas, siguro magpa-check tayo kaagad. Alamin natin, magkaroon tayo ng antigen test kaagad para at least maalagaan natin yung ating mga sarili. No? So, umiwas na tayo kung sakaling tayo ay may mga nararamdamang simptomas na COVID.
Okay, to wrap up our discussion, Yusek Cascolan, what is your message, of course, to the public as the Christmas season nears? Any reminders, of course, on how to celebrate the holidays with the pandemic still in mind?
Yeah. Well, Bonds, to all those who are listening right now, our advice is, of course, as I've said, before going out, check ourselves. Let's evaluate ourselves. If you feel something that's not good, come up with an antigen test. If not, then stay at home. We are trying to boost also our tourism so that we will come up with the development. We can develop our economy again. Come up with, of course, with a better atmosphere. It would be good that all of us will be checking ourselves, and of course, to all those my detractors and to those who have been discussing my how do you call this, my position here at the Department of Health. Don't you worry po, hindi po ako magdodoktor-doktoran dito. Okay, I am trying. I'm willing to help in any which way I can, most especially when it comes to operational management. Kung ako mismo po ang aalis kung sa tingin ko ay hindi po talaga ako kailangan dito sa DOH. I am just a public servant obeying orders from our president, PBBM. Of course, I would like to thank President Bongbong Marcos for giving me this chance to work with the Department of Health. And I would like to thank my co-employees, our OIC Verheri here in the DOH. I would like to thank them for a warm welcome and to be a team member of Team DOH.
Thank you so much, Yusek Cascolan, for joining us. So if you've just tuned in, we've been talking to Health Undersecretary Camilo Cascolan. Again, I'm Bons Magsambol. Thanks for tuning in.